10 signs your testosterone levels may be too low, putting you at future risk. When you think of testosterone, what comes to mind? Steroids, macho men, rage. There is a lot of misunderstanding out there on what testosterone actually is and how it plays a major role in men's bodies. Issues like decreased muscle mass, increased body fat, erectile dysfunction. You may be experiencing some of these things and not even realize it has to do with your testosterone levels. But should you turn to exogenous testosterone? Is it bad for you? Are there risks associated with higher or lower levels in your body? And are there any natural ways to boost it without taking supplements? Today, we are breaking down all the crucial facts and questions that you might be wondering about testosterone and its major role in your health. Hey everyone, I'm Dr. Jordan Wagner. I'm an emergency room doctor who treats everything from COVID to gunshot wounds, burns, you name it. I've created this video series to help answer some of your medical questions and the questions that I get from patients each and every day. If you find this video helpful, please do me a favor and subscribe. Here's the deal. Testosterone plays an important role in men's health and can be linked to certain diseases and issues that may just surprise you. For example, did you know that testosterone is a key player in prostate cancer? Or that women need testosterone too? Also, there's way more to testosterone than just getting swole. Plus, 10 different signs that you may be dealing with low testosterone levels. We're going to go into all of this, but first things first. What is testosterone? Testosterone is the primary sex hormone and anabolic steroid in males. In male humans, testosterone plays a key role in the development of male reproductive tissue, such as testes and the prostate, as well as promoting secondary sexual characteristics, such as increased muscle and bone mass, the growth of body hair, and the deepening of the voice during puberty. For women, testosterone comes in much smaller amounts. Testosterone production in men increases about 30 times more during adolescence and early adulthood. After early adulthood though, it's natural for levels to drop slightly each year. In fact, they may see a 1% decline after 30 years old. How does the testosterone work in the body? On a scientific level, signals are sent from the brain to the pituitary gland. This controls the production of testosterone in men. The pituitary gland then relays the signal to the testes to produce testosterone. A feedback loop closely regulates the amount of hormone in the blood. Then, if and when testosterone levels rise too high, the brain sends signals to the pituitary to reduce production. It's important to have the right amount of testosterone levels in your body. So how do you know if you have low testosterone levels? And when should you be concerned enough to start seeking out medical advice? Here are 10 signs that you may be dealing with lower than ideal levels of testosterone. Number 1, sex drive dips. Testosterone plays a key role in libido, aka sex drive in men. Although some men may experience a decline in sex drive as they age, men with low testosterone levels will likely experience a more drastic drop in their desire to have sex. Number 2, difficulty with erection. While testosterone stimulates a man's sex drive, it also aids in achieving and maintaining an erection. Even though testosterone alone doesn't cause an erection, it does stimulate receptors in the brain to produce nitric oxide. It's a nitric oxide molecule that helps trigger a series of chemical reactions necessary for an erection to occur. When testosterone levels are too low, a man may have difficulty achieving an erection prior to sex. But keep in mind, there are many other factors at play as well. Number 3, low semen volume. Testosterone plays a role in the production of semen, the fluid that aids in the motility of sperm. If your testosterone levels are low, your volume of swimmers may in turn be low as well. Number 4, hair loss. Although balding is a natural part of aging for many men, testosterone could be playing a role in your thinning hair as well. While there is an inherited component to balding, many men, on the other hand, may experience a loss of body and facial hair when they have lower levels of testosterone. Number 5, fatigue. If you find yourself tired all the time, despite getting a full amount of sleep, you may be dealing with low levels. It's best to discuss this with your doctor. Number 6, loss of muscle mass. Because of the role testosterone plays in building muscle, you may experience loss of mass in your muscles as well if you're dealing with less than ideal levels of testosterone. Number 7, increased body fat. Sometimes when there is a disruption or an imbalance of testosterone and estrogen in men, in particular, men can experience things like gynecomastia or an enlarged breast tissue or other areas of increased body fat. Number 8, decreased bone mass. Men with lower testosterone levels, especially as they get older, may have lower bone volume and are more susceptible to bone fractures and osteoporosis. Number 9, mood and mental capacity. If you find yourself with out of the normal depression, irritability, or lack of focus, this could be an issue with the levels of testosterone in your body. Additionally, both testosterone levels and cognitive functions, particularly memory, decline with age. As a result, doctors have theorized that lower testosterone levels could contribute to the affected memory. Number 10, lastly, low blood counts. Doctors have linked low testosterone with increased risk for anemia, according to a research article in the Journal of American Medical Association. Some risks and symptoms associated with anemia can include dizziness, leg cramping, sleep disruption, abnormal heart rate, and more. When researchers gave testosterone gel to the anemic men who had low testosterone levels, they saw improvements in their blood counts as opposed to men who only received a placebo. So, what in the world causes low testosterone, and should you be concerned about it? As we age, we produce less. It is a natural part of the aging process, but there are several other causes that can also result in lowered testosterone as well. Things like injury to your testicles, or pituitary disorders, cancer treatments, HIV or AIDS, inflammatory diseases such as sarcoidosis or tuberculosis. Testicular tumors are just some of the causes of low production of testosterone. And low production of testosterone can then sometimes lead to hypogonadism. In men, complications of untreated hypogonadism include loss of libido, failure to achieve physical strength, osteoporosis, infertility, and a range of other health complications. Testosterone replacement therapy is usually used to treat low levels and hypogonadism. Are there any possible side effects from taking testosterone therapy? Yes. Like other supplements and medications, testosterone therapy comes with risks and possible side effects as well. This is particularly true if you try to take it for normal aging rather than treating a condition. Short-term complications include sleep apnea, acne flares, enlarged breasts, testicular shrinkage, and more. Whereas men on long-term forms of testosterone therapy appear to have a higher risk of cardiovascular problems such as heart attacks, strokes, and deaths from heart disease. There is a lingering concern that testosterone therapy could also stimulate growth of prostate cancer cells. As always, talk to your healthcare provider first and foremost so you can go over things like testosterone testing to determine whether supplementation is the best option for you. Lastly, are there natural remedies for increasing testosterone? Well, testosterone therapy isn't for everyone. There are also natural remedies available that you can try as well to boost your natural testosterone level. Number 1, zinc. Studies have found zinc to be essential in helping to regulate serum testosterone levels in men. You can add zinc to your diet by eating whole grains and shellfish or through additional supplementation. Number 2, potassium. Potassium aids in testosterone synthesis. Add potassium-rich food into your meals like bananas, beets, and spinach if you want a little natural boost of testosterone. And number 3, lifestyle changes. Things like getting more physical activity, more sleep, and managing your stress are all things that can lead to increasing your natural testosterone level. All right, that's been a testosterone breakdown with me, Dr. Wagner. Have you ever taken testosterone boosters? What was your experience like? Let me know in the comments below. Also, let me know if you'd like me to make a follow-up video on how testosterone levels can affect women as well. Also, please make sure you subscribe and turn bell notifications on. When you do that and you hit that like button, you let YouTube know that you'd like to see more videos like this one. Thank you so much for watching and stay healthy, my friends.